Doctors of Reddit, what's the biggest case of faking it you've ever seen? Taking trauma call during surgery residency, had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal, but we would shield his legs so he couldn't see them and poke them with needles and other sharp objects, with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with SCIWORA, spinal cord injury without radiographic abnormality. He stayed in the hospital for a week, no improvement. Always had one guard with him. One night they were down in the lobby watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. Patient last seen sprinting down the road, naked butt cheeks flapping in the breeze. Made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. Truly playing the long con. Dermatologist here. Patient was convinced she had a melanoma and needed a biopsy and would need to be on workers' comp. I told her it looked like ink from a marker. She demanded a biopsy. I wiped the area off with an alcohol swab and showed her the ink and that there was no spot on her skin anymore. She stormed out threatening to sue. I'm just glad I cured her melanoma. Had a patient come in for a fall who now couldn't move their legs at all. Did a bunch of tests, didn't find anything. The patient was not at all fazed by suddenly being paralyzed, which was the first red flag. Didn't really believe anything was wrong, but the patient was still not moving their legs. My options are to admit for a huge workup or get them to walk. So I update them saying everything is fine, tests are negative, you can go home. Patient gets up, gets dressed and walks out without a word. So I update them saying everything is fine, tests are negative, you can go home. Patient gets up, gets dressed and walks out without a word. Jesus. We had a patient faking a seizure, so my supervisor told one of us to get the brain needle. The patient made a miraculous and swift recovery without intervention. That's the best part about most of these stories, when they make up some form of fake machine so that the patient stops faking. Cracks me up every time. Not a doctor but worked in healthcare for nearly 20 years. While taking a break from the ICU due to it being emotionally draining, I worked in home health for a bit. I had a patient who clearly had Munchausen syndrome. On a daily basis she would call her insurance to see what things would be covered if she was diagnosed with this or that. She called her doctor's office an average of 5x during my shift with her. She would report all kinds of non-real symptoms. She pestered the doctors into do exploitive laparoscopic surgery. Of course nothing was found. One day I walked in and she was rubbing her incisions with rotten cabbage trying to get it infected. She wasn't seeking pain meds, except to sell. Really she was just as happy with antibiotics or stool softeners, anything, as long as they wrote her a prescription and she got to go to the pharmacy where she did a whole song and dance for them too, claiming allergies and reactions. She always increased the exaggeration of her story too. One time she fluttered her eyes, after making sure I was looking, and said she lost consciousness in that half a second. She called the doctor and claimed she lost consciousness for 5 minutes, she called the insurance and claimed it was 10 minutes, she called the pharmacy and claimed it was 30 minutes, then she called 911 and told them she woke up on the floor after losing consciousness for 4 hours. The worst thing about her was she was a mom. Her son was 28 at the time, and by all the stories of his childhood illnesses and all her saying how he is severely disabled, I knew she basically fucked up his childhood with Munchausen by proxy. She portrayed him as being severely disabled and that's why he would never find a wife. I met him, he was healthy and of average intelligence. He wasn't looking for a wife, he was gay, but she refused to accept that. Working with her was so miserable that I took a couple years off from any and all healthcare after that. I worked at a detox with a bunch of people who like to exaggerate their symptoms for more meds. Now some were actually withdrawing really bad, but some wanted a bed and free drugs. There was this girl who was trying to raise her blood pressure so she could get some anti-anxiety meds. We do vitals every 4 hours, so when she saw us with the cart, she immediately went to the bathroom for an unknown reason. When the bathroom blinds are open you can see into them from the stairs by the entrance. The patient was doing lots of jumping jacks in her bathroom. So when it was time to take her vitals, she came out sweating. Of course we told her if she had high blood pressure, she couldn't smoke, so she promptly freaked out because she wanted the meds and to smoke. She came back a few months later actually wanting to be sober. I mentioned the jumping jacks and we laughed about it. She's doing much better now. Good times. Young, 18 to 20, woman went running into small rural hospital pretending to have abdominal pain. Police officer had tagged her going 40+ km over the limit, which was stunt driving as per the new law in Ontario, impound and license suspension automatic. Cop followed her into and apparently said he'd be waiting for her when she left. Locum staff such as myself were housed at a small B&B about 15 minutes away, and the had pre-printed order sets to be done before we arrived. When I arrived, she flat out admitted that she just came in because she freaked out and didn't stop. I told her we'd give her 45 minutes to call her parents, family before I booted her. Except BHCG came back positive, and subsequent ultrasound came back showing extremely early ectopic. Officer figures out something is up when he hears air ambulance call come in over radio. She was completely asymptomatic and just worked out that she dodged both charges and a life-threatening issue by accident. It was definitely a WTF moment. Edit. Well, this blew up overnight. I got a few messages. A little more info. Small rural hospitals in northern Ontario often service areas from more than an hour's drive away and still only have a catchment area of 2,000 to 3,000 people. When on call, it was just that. We would do our days in the community clinic, then maybe hospital rounds, then go home and be on call. We wouldn't be at the hospital. There wasn't an on-call room where you would stay, for example. There were lots of times that you'd go a full night without being woken up, or maybe just a call from the acute care inpatient wing. Locums were short-term contracts for places that didn't have full-time medical staff for whatever reason. It's hard to attract clinicians if you don't even have broadband internet in the community. They generally pay very well. Reminds me of an old post where some hobo came to the hospital speaking incoherently, and they decided to give him a checkup anyway to show to the students. It was a university hospital, and he turned up to have some issue with the liver. After they treated him, he became lucid, and turns out he was a professor on his way to a lecture when his liver stopped functioning properly and he couldn't think clearly because of that, so he was just wandering the streets for a while. Ectopic pregnancies are nuts. My mom almost died from one before my time. Her only symptom for weeks was horrible shoulder pain. Physical therapist here. Working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot. Wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk. Hips swaying, full stride, going places. We were all fools. To what end did she fake an injury? Sympathy? You guys don't prescribe, right? Removed. My brother was an EMT for 2 years and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego because the hospital is in Oswego, by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. We had a family calling for a Medicab, a cab paid for by income-based insurance, from somewhere out in the sticks to our in a college town, every few weeks or so. The mom would be seen for some ailment or the other. And the rest of the family would go to Walmart, go to the mall, do all their in-town errands. She was basically faking an emergency illness every few weeks so they wouldn't have to pay for a cab to get their shopping done. Sorta along the same idea. Working at a pharmacy, we saw a guy come in to try and get a refill on some pain meds that had no refill. After pleading that his ear really hurt, we told him again we couldn't refill it. One of the other employees saw his step into a side hallway and take a pencil and jam it forcefully into his ear repeatedly, drawing blood. He calmly left and went to the He came back a few hours later with a prescription for pain meds. This patient comes in for back pain with weakness of the legs. Gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. Patient is seen by physical therapy and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. Patient is infuriated that they're being discharged. Yelling and screaming about how they aren't better, how they're disappointed in the institution, blah blah blah. They said one particular thing that still clearly stands out 3 to 4 years later. "I can't believe you're sending me home already. I haven't even told my family I'm here, and now you're going to send me home before they even have the chance to see me." My attending and I leave the room to arrange things with the nurses. We go back in and the patient is out of bed and standing up in the middle of the room. Miraculously, the patient is able to walk with zero assistance when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged. We went into the room without knocking. They were discharged home after a conversation regarding abuse of medical services. Was the patient's goal to have their family see them in the hospital? Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated "hello" wave. She started to throw her arm up but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. I would never have expected pretending to be blind to be such a commonly faked issue, but reading this thread has changed my mind on that issue. A friend of mine likes to stick out her hand for a handshake when people come in feigning blindness. Nearly all of them instinctively meet her handshake. It's great to watch. Edit. I am very much aware of the different types of visual deficits, thanks for your concern. Deleted. Take the subwoofer away, damn it really makes sense when you put it like that. Haha, I cough as a nervous tick. It's always been something I've been embarrassed of, but I figured it was pretty inconspicuous. I remember when I finally got the courage to tell my friends I have a nervous tick, and I'll never forget they said, "Is it the coughing?" We figured there's no way you could have a cough for 2 years straight. Also, they do sound pretty fake. Sometimes my friends will tease me by doing an equally fake sounding cough right after I do. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking, tried to keep eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh, and of course his eyes were back to normal and focused. I am amazed he didn't ask for a discount, or to have a free checkup for some exposure. One time my roommate, who is an ICU nurse, came to see one of my indoor soccer games. During the game a player on the other team went down, hurt, and starting screaming in pain and swearing and rolling around while holding his ankle before he was eventually helped off the field. He then limped over to where the fans sat and watched the rest of the game brooding in silence before he left early. After the game my roommate told me he was going to go over and see if there was anything he could do to help, until he saw that the guy was limping on the wrong leg. I once saw a patient who had been faking paralysis of the legs for years. Used a wheelchair, never walked, etc. Old records showed extensive imaging, neurology consults, and other tests that proved the patient had full function of all extremities. Family, friends were just going along with it. Not sure if it was really conversion disorder or if the patient had some secondary gain issue. That's so baffling. I'm a part-time wheelchair user and I don't know why anyone would choose to make the world more inaccessible to themselves. Not a doctor, but am a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call saying that she had bled down the toilet but flushed it, and all the examinations we did came back completely normal with mostly no evidence of any bleed whatsoever. On occasions during speculum examinations we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding, walked into her room and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave, because she had 5 noisy children at home, needed some rest and knew we wouldn't admit her to hospital if it wasn't for a good reason. She would do it any time her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. Edit. So this got a lot more attention than I ever expected. There's a lot of questions regarding birth control and questioning her parenting, so thought it best to add an edit. This patient was not by any means a benefit seeker, they were a hard-working and loving family that had full-time jobs. She had been booked in to have her tubes tied but found out a week before the procedure that she was pregnant with this baby. She just couldn't cope during the pregnancy, and became very mentally unwell. She did not realize the implications or understand the face that she was causing massive harm to herself and her baby. She was referred to our perinatal mental health team and treated for psychosis. They also had a lot of input after she had her baby. She ended up having a C-section and was sterilized at the same time at her request. By all accounts she is doing very well now. Also thank you very much for the slivers. Imagine being so exhausted with your family that you feel the need to stab yourself in the vagina. Yikes. I hope that woman found the help she needed.